Hello, and welcome to our mini lecture on communicable diseases for child health. Today we're going to briefly discuss isolation, signs and symptoms, interventions and precautions, and room assignments for a few of the communicable diseases that are discussed in your text. The communicable diseases that we are going to discuss may be spread through airborne, droplet, or direct contact, and many of these are preventable with immunizations. The two communicable diseases that are transmitted via airborne in this chapter are measles and chickenpox. The two diseases that we are going to discuss that are airborne transmission are measles and chickenpox. In these two cases, the patient should be in a reverse isolation room, and any healthcare providers that are taking care of them should be in an appropriate mask like a duckbill or an N95. Droplet transmission is going to be erythema infectiosum, also known as fifth disease, mumps, pertussis or whooping cough, and rubella. And then our last one, direct contact. Those diseases are going to include conjunctivitis, which is pink eye, mumps, pertussis or whooping cough again, rubella again, measles, and varicella or chickenpox. And just to briefly add to the direct contact mode of transmission, mono can be spread in saliva. Pertussis or whooping cough can be spread through indirect contact with like clothing and things like that. And then varicella can be on objects. And you'll notice that several of these communicable diseases are spread in multiple ways. So you'll want to keep that in mind when you're picking your protective PPE when you're walking in the room and educating your families. Now we're going to move on to some of the key signs and symptoms we see with a few of these communicable diseases. Conjunctivitis, which is pink eye, can be viral or bacterial. I've included a picture here to show you. You'll notice that a healthy eye obviously looks normal. The viral and allergic are kind of hard to decipher, but you can see in the viral picture there is some redness of the sclera and conjunctiva, but no redness or swelling of the eyelid like there is in the allergic. And the real telltale sign of a bacterial conjunctivitis, which is going to be a pink eye that needs drops because it's bacterial and it needs an antibiotic drop, is going to be that crusting. So you'll have your red sclera, you'll have some swelling of the conjunctiva, lots of tearing, and then a yellow-green purulent discharge from the eye can be one or both, very easily spread from one eye to another, especially in children, as you can imagine. And then there's also crusting of the eyelids in the morning in a lot of cases where the eyelids are crusted shut, and parents will use a warm compress to kind of break down some of that discharge before the kiddo can open their eye. And it can be kind of scary for parents and kids, but we can generally treat it very easily with topical ointment or drops. I've also included a lot of signs and symptoms here for mono. Many of you have probably had mono. We see this a lot in school age to teenagers, adolescents, and adults. Highly contagious. The symptoms are often just typical viral symptoms with fever, lethargy, sore throat, headache, loss of appetite, swollen lymph nodes. White blood cell count can be increased. And then the important things to remember with mono is the risk of splenomegaly and the risk of a ruptured spleen. And so in those cases, we educate the parents once we've gotten a definitive diagnosis, which is usually done by either a rapid mono test or a EBV panel or titer that we send to the lab. It tells us if they have like an active infection or a past infection. If it's active, we have to make them sit out of contact sports. We do 2 weeks. Which is very difficult in kids because life is a contact sport for many of them, especially if they're a younger kid that can't really control their body as well. And so the words I try to use with my patients are nothing but walking. That means obviously no sports involving, balls or rackets, no jumping on a trampoline, no riding on a bike, a scooter. It's difficult. Swimming even can be, contact when you're talking about kids. And so just keeping that in mind, and we usually will check them again after that 2 weeks for splenomegaly. And if they don't have any enlargement, then we're okay to clear them for sports. Signs and symptoms of Fitz disease are going to be a red rash to the face. It is a slapped cheek appearance. Once you have seen it, you don't forget it. This little kiddo has a pretty good slapped cheek appearance. And then they also have a maculopapular red spots to their upper and lower extremities. It often looks kind of lacy or splotchy in appearance. It doesn't itch at first, but it will itch at the end. And oftentimes they'll have general malaise and headache with this as well. Whooping cough or pertussis. That is going to start out with some common cold manifestations and then severe coughing fits that are very violent with very rapid coughing and a loud whooping sound upon inspiration. There's a very good sound bite on that YouTube link on the bottom of this slide where you can listen to it. And the noise that that kiddo is making between coughs is very typical for pertussis or whooping cough. Chickenpox or varicella. Again, start with some of those kind of viral symptoms, fever, fatigue, loss of appetite, and headache, and then we have the rash. Usually start in the center of the trunk, spreading to the face and proximal extremities. We'll often see it along the hairlines, like you notice in this kiddo, kind of down where his hairline meets his neck. We'll also see it on the forehead, at the hairline there on the scalp. And then it progresses from macules to papules, to vesicles, so fluid-filled vesicles, and then a crust forms. And the scabs appear in 1 week, and they are no longer contagious once those scabs appear and the crusts have formed. Interventions for varicella should focus on comfort care. So calamine lotion, keeping them cool and comfortable, avoiding skin irritants, those kinds of things. One of the most important parts of taking care of kiddos that are sick is educating them and their families. And so when we think about communicable diseases, a lot of our education is going to be based on how did the kiddo get it, how can we prevent other kiddos in the house and the parents from getting it if we can. Incubation period so that they know when everybody can go back to daycare, school, work, when other siblings are safe, when are grandparents safe to come help. And then the time frame for the communicability. So there's just a lot of education that needs to go into this, and that's a big part of pediatric nursing. Another important key point to remember when educating families is hand washing and how to do that effectively for the kids and their parents. Any visitors that are coming in and out of the hospital should be educated, and of course healthcare providers should be role models for that. In addition to isolation supplies, which visitors will need when walking into some of these rooms, and you'll see when you're in your clinical for child health, some of these diseases, the hospitals will not allow visitors, especially children, visitors that are children, so siblings, cousins, friends, things like that. One of the other things to consider when you're a nurse, when you're a charge nurse, pediatric nursing, this is not specific to pediatric nursing, but since we're talking about that, that's kind of what we're focusing on today, is that room assignments should be made keeping the different communicable diseases in mind, right? So we don't want a nurse caring for a patient that's undergoing chemo and is immunocompromised also caring for a patient with pertussis, right? Even though we're using our precautions, and I know during COVID these rules kind of had to slide a little bit, but we think about in an ideal world, right? Same thing with two patients with the same communicable disease could be, in a shared room in the ER, or if there are any units with semi-private rooms anymore, that could be an appropriate assignment. But just kind of thinking through that as a nurse, if you get that assignment, you'll want to question it. And then as a charge nurse, which y'all are going to be, you'll want to think about that when you're making patient assignments.